Assalamualaikum warahmatullahi wabarakatuh. Indonesian COVID-19 transmitted population density driven likelihood instead of education driven population. Presented by Nuniek Nizmah Fajriyah, Nur Izzah, and Eko Mugiyanto from Faculty of Health Science, University Muhammadiyah Pekajangan, Pekalongan. The background: as of 15 December, there were more than 50 million confirmed cases of COVID-19 and more than 1 million deaths worldwide. The first known case of COVID-19 originated in Hubei province, China, in the city of Wuhan. Wang LS et al. Reported the SARS-CoV-2 is spread dominantly through respiratory droplets during close face-to-face contact. The infection can be spread by asymptomatic, presymptomatic, and symptomatic carriers as presented by Zhou F. et al. The average time from exposure to symptom onset is 5 days, and 97.5% of people who develop symptoms do so within 11 and 5 days, as reported Ionis Jabetakis et al. Indonesia had an average annual population growth rate of 1.49% between 2000 and 2010. By 2020, the improvement will hit 1.07%, which means that Indonesia is growing by around 2.73 million people a year at present. The growing population is a concern not only for Indonesia economy, but also had related issues, particularly in recent situation which is hit by SARS-CoV-2 virus. Even though it is common to correlate population with disease spread, but limited study demonstrated association between transmitted disease is this case COVID-19 with population density. Here, we will show the relationship between coronavirus disease and the demographic structure of the province of Indonesia. The aim of this study is to analyze the association between coronavirus disease and demographic structure among Indonesia province. This study was a descriptive study. The population data in this study extracted from the Indonesian Central Agency on Statistics published on 2020 and COVID-19 patient data extracted from Indonesian Official Central for Disease Control for COVID-19 data.
Hello everyone, I'm going to deliver the result and discussion sessions. The data took from the Indonesian Official Central for Disease Control for COVID-19 assessed on September 30 and extracted from the Indonesian Central Agency on Statistics published on 2020. From the data, we know that Jakarta contributed more than 25% of total COVID-19 patients among provinces in Indonesia. These are the correlations between the people density and COVID-19 contracted. From the data, we know that Jakarta have higher number of COVID-19 patients than other provinces in Indonesia. The reason is because the Jakarta is the capital city in Indonesia, occupied by more than 10 million people live in Jakarta, and we know that the area is smaller than other provinces in Indonesia, and followed by the East Java, Central Java, and West Java. All of the province is located in Java Islands, because the Java Island have higher people density than other island in Indonesia like Sumatra, Kalimantan, or even Sulawesi. Here we want to make correlation between the education history against COVID-19 contraction, and from the data we couldn't see the correlation between the education history level against the COVID-19. Here, like in East Java, have higher education, but also have higher COVID-19 patients. So it means there's no correlation between education history and COVID-19 contracted. And here the COVID-19 contracted and morbidity rate of Indonesians. From WHO mentioned that the elderly is the vulnerable population, and although the elderly is the vulnerable population, but the death number in adult population dominantly both positive and death COVID-19 case, indicating that adult population has similar risk with elder population. Because the reason is adult population have are more active than other population like elderly or juvenile or child population. That's the reason why many adults population contracted with COVID-19. And this is the ratio between poor and rich population that's contracted with COVID-19 among the Indonesian province. It is common knowledge that the rich population have more resource than poor population, but here we couldn't see the correlation between the rich population or poor population with the COVID-19 patient. So it means that COVID-19 spread across either rich or people or rich or poor people. The last data talk about the comparison between men and women contracted by COVID-19 within Indonesian province. And from the data, women seemingly has higher risk to COVID-19 than men, shown both for positive and death group of COVID-19. Even men more active, relatively active than women, but women have higher risk than. I think that's the results and discussion. Thank you.
My name is Nur Izzah. I am a lecturer from Universitas Muhammadiyah Pekajangan Pekalongan. I will continue to the conclusion. So based on explanation above, we can conclude that COVID-19 spread intensively in dense population provinces like Jakarta and the province in Java Island, that a dense province. Educational background seemingly did not contribute to lower incidence of COVID-19. The implication of the study is for the government. It is obvious to take necessary action to fight grouping people in large scale. The further study is needed to confirm this finding. Thank you for your attention. Any question and suggestion is very welcome.